late, so I sent a message to my nurse, to Akis, to text you.
Akis, he told me. Marc, viens mon chéri.
Il a rien demandé.
Yeah. Marc is coming to tell you hi.
I have another fracture to take care in a little bit, so I have to go back in the OR a minute.
Yes,
Hi, Mark.
I
Nice to
think
see
so.
you.
Here is my son, he's Mark. He's 11 years old.
Hi, Mark. Nice to see you.
I just have some question. It will be very quick because he was operated with Dr. Nuzo last summer.
Yeah, I know everything. You send me everything, so
Good.
I have an idea. Yes.
So good. I have just...
You were in excellent hands.
Thank you. Thank you very much. Yeah. Sorry, my English is not my native language, as you know. So maybe I have some thoughts when I'm talking.
No worries for that.
I have some questions because I want to follow him. And as we talked with Dr. Nuzo, he's not usual case of cerebral palsy because he had a cardiac arrest during because of his heart problems, but which was solved between times because he had 5 cardiac operations and it's solved. At any case, we're checking every time, it solved cardiac problems. But the problem, he has mostly dystonia, not dystonia, mostly. A little bit spasticity, but mostly dystonia.
Okay.
So, for example, during our operation with Dr. Nuzo, he had even dystonic reaction for the cast. We had to cut. I have a present from Dr. Nuzo, you know.
Okay. So
To cut because when we was just after operation, the nurses they had no anything to cut his cast.
That's why when I put a cast on, I put the cast by valve so that the family can remove them if needed.
Yeah,
So,
but it was not the case in the United States. So we have to cut with something we had on hand with nurses.
Yeah, that's very cool. Yes.
Yes, but
So you cut it yourself. You cut it yourself.
the second one I cut it by myself.
Okay.
And it was really good that I cut it because when we came to Matt,
It's very difficult without cutting him, right? Okay.
without cutting him, I was very careful. I was very careful, and that was interesting because when I cut even the second one, after 8 days in cast, his left leg also had a little bit dystonic reaction.
Yeah, that's something. Sometimes that's something that happens. You know, it's.
I think not for all children, but in Mark's case, we have to think about this. And I know there is a doctor in Germany. He is doing the pre-open cast with scratches. It's something new he started to do, but I'm not so sure that he's doing exactly the Dr. Nuzo operation. I think he's doing mixture of operation.
Okay.
It's
Yeah.
my point of view. I don't know because I know he was in the connection with the Russian doctor who's doing Dr. Ulzibat method. And then he came to Dr. Nuzo and now he's telling that he's doing a Splm. He started with a lot of Russian parents, and as I speak Russian, I can see this.
Okay.
So I see the both sides a little bit, and I have some questions about
Yes,
this.
please ask me anything. Yes.
So, what I want to ask you about Mark, we want to follow him, and as I know, when I have to really expect, then maybe his problem with echinovirus can come back because he will be growing. You saw the father; he's very big, and Mark will be big. And we know that it can come back when they are growing sprouts. So
First
now,
of all, I want you to tell you that you have done an excellent work with him. He is now, because I was able to see him walking towards the camera, and he has been in great hands actually. And what we know is that yes, as they grow, sometimes they tend to get tight. This is not always the case, though. Statistics tell us that this is going to happen in 1 out of 3 kids. And if someone, and that also depends on how active a kid is, how the family is focused on doing exercises, how active is the kid in playing, doing activities. And the more active you are, the less possible is that you have to go back into the operating room. So just for your peace of mind, yes, it's a very sensible way to expect that to happen. But I want to tell you, this is not something that's going to happen for sure. We know that it's going to happen in 1 out of 3 kids, and this is something that we've seen, and Roy Nuzzo have seen that. So what I will tell you is, you have excellent videos of him as he progresses. So just check on every 6 months or every year. Just get a video and just send us a video. You can also send to my physiotherapist, and he can assess the videos, and we can talk. Yes, Akis Vretos, he knows Nuzzo as well. So I would suggest that you have just prepare a short video of Mark coming towards the camera and walking away from the camera without having anything covering his knees, and then one more short video of him from the side. Of course, if you notice, because you're a knowledgeable person and you know and you can depict fine changes, yes, if you see something, tell us. But just remember, wait for a few weeks, because as he grows, especially if he hits a growth spurt, some things can change. But then, because you're doing so many things with him, he can probably go back to, a much better position. So don't get too frustrated if you see him change a little bit as he grows. Give him some time, and if the change persists, then we need to know about it.
Okay, I understand your point. So generally, I have to see it's 1 in 3 child, which it's possible that we needed more Splm operation, because we was talking with Dr. Nuzzo with maybe possibility of transfer, tibialis transfer, maybe.
It's not something certain, maybe.
Maybe, but we prefer to make it later, maybe in growth age, 18, 19 years old, because I think it will be much more easy on the psychological level of the child to keep on with such kind of operation, because transfer, it's more big operation, at any case.
Yeah, well, it depends. We do a fair amount of tendon transfers if we have to, but as I said to you, we have to wait and see. And also, there's a way to assess if someone is still growing. Just getting an X-ray of the hand and of the wrist and hand AP X-ray, we can tell if someone is going to grow or not. And we know that if you have a bone age of 16, being a boy, that you're not going to grow anymore. So we have tools that are going to tell us that Mark is not growing anymore, and that will put an end on your kind of agony if he's going to get worse. So we can assure you that if he's growing or not, and that will put an end to your
I think he will be growing in any case. He's only 11 years old. For sure he will be growing.
What I'm saying is about bone age.
Bone. I have the latest X-rays from 8 March this year. After operation, I can send it to you if you want.
It's an X-ray of the hand. It's called bone.
Not hand, but I can make a hand X-ray if you want.
Not now. Don't do that now.
Don't do that now.
I'm going to tell you when. As he approaches the age of 16. If I'm still alive, we can get this.
I hope you will be alive, because everybody retiring. Dr. Nuzzo is retiring, and I've heard that Dr. Ivgi also going to retire.
That's a sad thing. I'm gonna meet him next month, so we're gonna get together late April. So
because I'm trying to connect Dr. Nuzzo with the French hospital. Maybe doctors, they interested in operation because they saw Mark. But
Yes.
I don't know if it could pass or
My
no.
group, we have written a number of papers now that your doctors can read because we were able to publish data from our patients.
So I want you maybe can be invited by the Zoom because they
have
promised me to organize the Zoom with Dr. Nuzo from French hospital. It's
we can
very
find these
rare.
papers. We can find these papers in the literature, and
I
actually,
know. I read your
we can-
papers in the
just
literature.
a week ago, another paper got accepted. So it's going to be published next month. So we have more data coming.
Yeah, it's good. Next question. Maybe between Splm operation, it will be good in case if I see something to come to Greece, because, for example, from France to come to Greece, it's not so far. It's not United States, you know.
Well, you are more than welcome to come whenever.
Yes, but in any case,
It's not a matter of. We'll be glad to see you in person. What I'm trying to do all the time is to avoid having families go through too much of a burden. So
I understand.
we'll have to see. We can see the videos first. We can have a Zoom call, and of course, yes, I would be more than happy to see you in Athens. Not a problem.
But no. My question is if ethanol blocks alone without SPLM can also make some effects, and it's even much more easier than than the operation. So if I have any doubts and I send you new videos of Mark, maybe we can do just ethanol blocks, as Dr. Nuzo said
Yes,
me.
we do that. We do that all the time. You have to imagine these are different tools. We use them appropriately. Some kids they need only alcohol blocks. Some others you can use SPML. And how you can tell that? First of all, by clinical examination. What we do is I use I use information from three different areas. One is we're trying to do gait analysis here, in one of our labs. And Roy Nuzo just sent me a very interesting new way of assessing videos, and I'm working on that. He developed a new way of video assessing. Then we have the clinical examination. That's another piece of very useful information. But the other one is, if we decided to go into the operating room to do ethanol blocks, for example, we spend some time to examine a patient under anesthesia. So we know then that it's not only tone that you have to address with the ethanol block, but you have to do a little bit of a lengthening procedure with the SPML. So if you find something that is tight, you can find that when the patient is asleep. So if you have someone just for the ethanol block and you see that one of streak of tissue is there tight behind the knee, you can just take a little bit of taking it away.
Yes.
So because you're there, you're in the operating room.
I understand.
So we
Absolutely.
do that all the time. We discuss that with families, and if you're happy with that, we can do it.
Okay.
No questions about it. And the other hand, if we don't find anything tight, we only do the ethanol block just for the tone, and especially that works for dystonic kids that have dystonia. These kids, when they are asleep, everything goes away. So you only have tone. Then the ethanol block is a great tool to use and address that problem.
Okay.
So yes, the answer is yes, we do that.
Okay, I see. I have two more questions for the other mom from Belgium. He already contacted you also. And so I think she's waiting she asked me just because she found that ethanol if ethanol blocks can give more tightness in spastic child. After some
The
ethanol blocks, she found that the leg of after ethanol blocks became more tight.
That is not correct. Something is wrong. I guess unless they're misreading the phenol blocks.
No. She did a Splm with Nuzo. With Nuzo, it's not possible. It's not phenol. It was ethanol.
Okay, ethanol block and Roy and ethanol block that Nuzo did, and then the kid went to tight muscle. I'm having a hard time to agree with that. Something else probably happened.
Yes,
I'm not
because
sure.
she found that the leg where was operated in some weeks became more tight than it was before. It's
Well,
just a question.
I'm not sure about that, and I'm sure that the ethanol does nothing about it. What the ethanol does is the ethanol block. You have to imagine that as, let's say that the nerve is a big highway, and inside the highway there are lots of cars, there are lots of nerve stimuli traveling from our head all the way down to our feet and muscles. What the ethanol does is like creating a small speed bump, if you understand me.
Yes,
So
I understand
instead of
absolutely.
instead of having many cars traveling down the road, traveling down the nerve, you have one after the other. And then the kids can process that information. If you have a lot of information, it's very hard to control that. You want to walk, and then you have so many muscles kick in. It's very hard for you to address all of them. But if you have two or three muscles kicking at the same time, then you have the time to organize
process.
that a little better. So I don't have the connection between ethanol and tightness. Something is missing here. I'm not sure I can follow that.
Okay. And she asked me another question. I'm just reading her question. Is it possible,
Please, no problem.
because her son was operated only one leg, best leg.
Yeah.
So, and the best leg is going worse after SPLM than the bad leg. Is it possible that there is overcompensation?
Well, sometimes it's not overcompensation, but it's you have you probably instead of having a hemiplegic kid, it was more of an asymmetric diplegia.
Asymmetric, yeah.
So having I'm sorry about that. It's the operating. I'm sorry. I'm just gonna have to slow them down.
Go.
No.
It was the last question.
No worries. You have to ask me anything. They can wait. So can I just answer that for a second?
Of
Please?
course.
No worries. They're done. So what I'm gonna say to you is sometimes you have an asymmetric diplegic side, and you address only one leg because you think that's worse. And as you take away, because SPML is very powerful, especially if you do alcohol blocks and SPML, you can eliminate spasticity, eliminate tightness, and then you have in front of you the little bit of tightness on the other leg that you thought it was normal, but it was not normal to begin with. Probably you had an asymmetric diplegia.
Yeah, I see. I understand. Yes,
We do
absolutely.
and you have to imagine and try to explain, is what you see a compensatory mechanism or it's something that actually there?
I see. It's just something there, and after SPLM, you're starting to see it.
Yes, because it's kind of an unveiling, it's an unveiling procedure. You took out the spasticity on one side and then you have...
And then you see the other side, in fact.
Yeah,
Yeah,
it's
I
not
understand.
a side effect. It's something that it's there, but you don't see it before.
Thank you very much. In fact, I asked you all the questions I had,
Are you
and
sure? I don't want you to feel in a hurry. I have all the time for
no,
you.
no,
No
problem,
Okay.
no problem. I'm
Okay.
really happy that you answered me because I know that Mark is not at the point to have a new operation for now. We're only 7 months after
I want you to
operation.
relax and enjoy all of the things that you have. You were very, very successful. As a mom, you did a lot of things, and you have to be very proud of yourself, and you have to enjoy what you have done.
I just want you to send my book in English if you want to read,
Yes, please.
because
Yes,
I gave it to Dr. Nuzo also.
Yes, please.
I wrote it in French
I
and
would
then
love to do
I
that.
translated in English. We did a lot for Mark and a lot of different researchers in the world. We started with hyperbaric, which is not usual in France or even in Greece. We did in Israel, and it was really good for him. But it's at any case it's very interesting. I'm really passionate about scientific research. In fact, I'm a scientific myself a little bit, but I'm in chemistry and so on, but not your way and not your level. But I love to talk with them.
Everybody, it's a teamwork. Everybody has to do something.
Yes.
And especially I mean, I was trained in the United States. I was a clinical fellow there for 5 years, and I knew I was trained in the classic way of doing all these big operations that we were, very keen on doing, but the kids were not doing well. And then when I heard about Roy, I was hesitant, and I met him in 2001, many, many years ago. I was one of the first guys I ever went into his office, and I said, I heard about your job. I have seen kids that you actually change their lives. So I want to know what you're doing. And he was very kind. He's a very kind person.
He's exceptional. He has sense of humor. Sense of humor, exceptional.
And then I spent like 10 days with him. He let me operate on his patients because I was trained in the States and I had the license to operate there. And I really, it changed my practice. I came back to Greece in 2001 and we have been operated in more than 1,000 kids. And we have changed. And then there's not even one kid that became worse with Roy Nuzzo's approach in cerebral palsy. And you have these patients living the same day at the hospital. They're doing physio, they're standing. So he changed the way of practicing and dealing with CP.
But still, as you know, the medicine is complicated.
The problem is he's retiring.
Yes, he is retiring, and I've heard that Ivgi also is retiring in United States. The United States parents, they will have problems.
Well, maybe I have to retire too.
Oh no, sorry, no, you stay, because where we go then? Everybody.
You're fine.
And for us, it's even closer.
Great to talk to you. And
thank you very much, Dr. Kanellopoulos.
You need something.
I'll just ask you one more question because I'm in a group with an international parents, and I did an registration of our talking. Can I post it on the group?
I don't mind. It's my pleasure.
Okay. I have to ask you. I can't to post anything without your agreement.
No worries for that.
Because a lot of parents get a lot of information from this, and it's answering their questions maybe as well, and takes less time from you.
To answer questions. I hope they can find the conversation useful. But I enjoyed the conversation with you.
Thank you very much. Thank you enormously. I will be in touch with you. As I have a question about Mark, I will send you a mail and we'll communicate by mail. Thank you very much.
And also you can email my physio.
Yes, and I have your address. I will send you my book. You can read when you have time, of course.
I will.
Okay. Thank you. Thank you very much. Thank you enormously. Thank you.
Bye-bye.
Bye.
Have a good night. Bye.